Colleagues, good afternoon. We would like to start our session. We're sorry for a little delay. Today, I think we will be talking about the most interesting thing that we right now have in medicine. We will be talking about cooperation in the sphere of medicine, but from the point of view of information technologies and their implementation. Nowadays, information technologies accounts for 20% of all the expenses of the medical healthcare sphere, and this market is growing very rapidly. We expect that by 2025 the artificial intelligence market will grow by 20 times. That is why this is a very interesting subject. We do not really know whether it will be the case, and so we will anyway we'll be keeping a very close eye on trends and different perspectives, advantages and disadvantages, difficulties related to implementation of the technologies. We will be thinking about whether we are moving about the right direction or probably it's kind of a delusion. I would like to introduce our speakers today. Vladimir Makarov, Deputy Head of the Department for Information Technologies, Moscow. John Brownstein, Director for Innovation at the Boston Children's Hospital. Professor Li Huyong, Director for Digital Profile and Bundan Seoul National University, and Dmitry Shemenkov, Director of Informational and Social Technologies in Medicine of the university, named after Sechenov. The first floor will be given to Professor Lee, and we ask him to talk a little bit about information technologies that have been applied in Bundan, and Bundan is one of the best centers in South Korea. And what kind of difficulties do you have dedicated to the implementations? What kind of barriers have you overcome, and what advantages and disadvantages does it present for the hospital? Thank you.
Thank you for kind introductions. I will introduce our healthcare innovation park. Actually, we call HIP. The background for we made it the HIP is a kind of a new building for cooperation between the business part and the medical part and the academic part. As you know, the recent innovation of the medicine field is needing a cooperation between the new high technology and also with medicine. But considering the high rate of the success rate, in the start point of the communication between the medicine part and the businesses and technology part is very important. We analyzed some of the cases which was failure during the process, as most of them are only the technology part started to develop new technology, and then they wanted to implement the technology in the endpoint of the development. In that case, most was a failure because they did not understand what is needed in the real clinical field. So on the start point, the communication between the two parts is very important. The technology part has to understand the process which is going on in the clinical field, and also what is needed that medical doctors are wanted. And also the medical doctors could be understand, not deeply, but the advantage of the new technologies compared with the technology they are using right now. Our mission is like that one, but well, it's a very good word. Next. In the figure, we can see that our hospital has located in the right side of the slide, and the left side is our HIP New Innovation Park. So it is very close. Anyway, to keep frequent meeting is very important, and that is the reason we located in our HIP park near our main hospital, because most of the businessmen complain that it is not easy to meet the doctors because they know doctors is very busy and they don't respond fastly to their requirement. So anyway, if they are closely located, the meeting will be much more frequently happen. Okay, next. Seoul National Bundang Hospital has a little bit special locations. Near our hospital, there are several technology cluster. Mostly there are IT technology cluster, and the most new startup or big IT companies are nearly located from our hospital. So we have a very good positions in the hospital view to work together with the new IT business partners. So this is our building. So actually this is a 7th floor and a little bit huge compared with our hospital. And we also have a translational research institute because our hospital is proposing not only for IT innovation for medical field, but also the biological research is also needed for our medical innovations. So for that kind of a purpose, we have a wet bench, and to do some kind of animal study for preclinical research, we have a new translational research institute with the small animal imaging and some of the big animal study for kind of a new surgical technique to develop in this institute. For the close approach between the HIP to the main hospital, we made a tunnel between the hospital and a HIP building. It only takes 2 minutes to walk around, through the tunnel to hospital to HIP buildings. So it is very close, and the approach is much more fastly could happen. Our research facility has a preclinical research center, clinical trial center, and also have a biobank. It is very important for the validation of the new technologies and new drug development. Also, healthcare big data center, precision medicine related to next generation sequencing, and also healthcare ICT research institute, and also we have a healthcare technology licensing centers, because during the process, and we have happened some kind of a patency, and we have to make a agreement between the company and the hospital. So we have a rule for what we have between the hospital and business partner, how we're going to transfer to the IP to the company, and those kind of works are very increasing right now, and most of those kind of agreement and negotiations are doing through the healthcare technology licensing center. And also we have a business incubation center to make education for startup, and breeding center for startup to grow to the big company, because they have a good idea but a small amount of fund, so they need some kind of a support. And also those kind of a startup doesn't have much more big funding, so they are not easy to approach to the doctors. So those kind of education field are what we're doing to making a new startup to grow up. This is a research field that we have a main lab for wet bench, and most of them, 80% are used by our professor, and 20% are used by the company, and also a core lab, so we could share our some of the big or high quality devices. And also we have a healthcare ICT research institute for PHR and HIT and other big data and IoT mobile. And also we have a medical devices R&D center. These centers are doing some kind of, if the company made these new devices, they have to test it. It is compatible for using in the clinical field. So we have a kind of a small similar loom as an operation loom or inpatient loom. So the devices is really compatible, or if there is something they have to fix it up, those kind of tests going on in this center. And also precision medicine center, because Melanges is a kind of a hot item for the clinical field. And also healthcare big data centers are gathering our cleansing of the data and joining with the other social big data to making a big data research support. Next. And also, I told you about the healthcare technology licensing center to make a negotiation with the business partner about IP. and also business incubator center to make a support to the startup, and if they're growing up, and it's to support it cooperation with the medical professors. Next. Also, we have a usability test laboratory, so you could see there's some kind of operation room or inpatient's room. So when you make a new devices to propose for using in the operation room or in the hospital, we could test it with our nurse medical team, and they will give a report what is the advantage of this devices or some of the disadvantages of these devices. So during those kind of report, the company could be re-innovated their devices. There's also mixed reality labs, so kind of a VR or AR technique could be developed and tested to the patients and for medical purpose. Also in this building, we have a conventional facility to make a conference between the company and medical doctors, so they could have a field of the cooperations. And we want to making a building ecosystem, so those kind of things, the cooperation between the medical doctors, PhD, and the business field, those kind of three teams are needed very closely to understand each other's. And in my personal experience, to understand each word, each field word, it takes at least 2 years to 3 years to cooperate it. So for those kind of long-term cooperations, we have to frequently cooperate with each other's words. And in this HIP buildings, many companies are also located inside the building. So we could cooperate with this company, and these companies are making in the new IP, and also there are much more have a favorite to work our hospital. I think this is the end of our. Also, we have an in-house advisory group, so there is several proposals of the meeting of the doctors, and we show this information to the company inside our HIP, or we have a network ecosystem, and share our information with the business partners, and then they could join this kind of a meeting. And if they needed some kind of a demand for hear sound from the medical doctors, we could connect it with this advisory group. And also R&D education programs are going on for the business course, convergence course, and research course. So not only for the medical doctors, but also for startup and also for the PhD. So we could do it, keep going on about the education for each field. And the network, for also the network, even we have a holding. So because not only the official meeting, but we open some kind of a forum, and we call a hub and spoke network meeting. So we do it in once a month, and have some kind of a beer, and joining with the medical doctors and business partner, having a little bit non-official meeting, and making a showing of friendship. Okay. And this is our HIP network for bio, academy, and institute, and so on. Also, the government part is joining in this HIP buildings to cooperate it between the 4 groups. Okay. And for the commercial outcome, we did it, our best care, the HIS hospital information system has been imported to the Saudi Arabia, United States. Also, we are trying to import it to China and Japan. And some of the domestically, we do it in other national hospital are using our HIC system. And also some of the things we have developing has been have an approval from KFDA, and some of the companies are doing a good business outcomes. And commercial outcome, we have many patents and patient care and a smart hospital model we have been developed, and testing in not only inside our hospital, but would communicate with the other hospitals. So those kind of a cooperation was going through the hospital to networking with multi-institute trials. Okay, thank you for listening.
Professor Lee, thank you very much. So it turns out that this is not like a hospital in the true sense of the term. This is like an agglomeration, yes, with different spheres and applications. Is it more of an exception in South Korea, or other hospitals are also more or less like you? Or is it more of an exception? Or maybe it is a trend of the future that will be applied in the rest of the world?
As I know, many global university has this kind of a cluster, not only in Boston and also in Sweden, and other big global university has this kind of a business and academic cluster. But in Korea, like this system is not favored. So many universities are coming to our hospital to learning this system because, as you know, that for those kind of building, making those building is needed a big fund, and also in Korea, most global universities inside of Seoul. So if they wanted to make those kind of a system, they need a big funding. So it's not popular in Korea, but as I think it is already currently doing in other countries, and it's not actually the future, but it is those kind of a trend will be going on.
Thank you very much once again. Colleagues, I suggest that we should postpone our question till the end of the session because we are going to have some other speakers as well. And I would like to give the floor to John Brownstein, Director for Innovation at the Boston Children's Hospital, so that he can extrapolate a little bit more on his experience in terms of implementing all those innovations. John, please, over to you.
Well, thank you again. To follow the work that is happening at the Healthcare State Park that we just saw, because actually what we're doing in Boston is actually a very similar ecosystem and cluster that's being developed to bridge together hospital systems, startups, large companies, all towards the goal of improving healthcare. I'm at Boston Children's Hospital. It's a top pediatric hospital in the U.S. and has, sort of global reach. And our mission has always been about providing best-in-class pediatric care to the globe. And that's a great mission, but also incredibly challenging to do when you're one place in Boston. And that's where digital technology has a real opportunity to sort of extend the reach of a singular hospital that has incredible data, incredible clinical expertise, and actually some really world-class health IT experience, but no essentially global reach. And that's where digital technology can help extend innovation, extend reach, and bring us to sort of more kids in more places. The way that we do this is through partnerships, startups, larger companies, networks, where they have scale, they have technology that can help deploy our know-how into new ventures and startups, very similar to the talk that we just heard. We're very focused on this idea that digital and our innovation group can do a variety of things. One, take innovation within the organization, exciting new ideas and inventions, and bring it to market. Work with startups as well. Also execute on a digital strategy for the hospital. We recognize that technology is going to be sort of a staple of the delivery of care in the future, right? Just sort of how banking was transformed with technology. Very similarly, we're going to see that sort of reinvention with healthcare, as well as aiming to be sort of on the cutting edge of new technologies. And I'll try to touch on some of these things. What's unique about our institution at Children's Hospital is that we're about 100 people, and we're a combination of software developers, user interface designers, business strategy. So it's not the usual types of people you might see in a hospital. But together they can help sort of combine around an idea. The other thing that's unique is that we bring together an advisory group, again, very similar to what we heard, which is not trying to think, and within Harvard University, it's very easy for people to assume that every idea they have is very good, and it's very hard to convince people that their ideas are bad. So we turn to the rest of the outside world to help us, guide us on what ideas are worth putting investment in. And so we work with venture capitalists, we work with CEOs of companies, we work with a variety of people in the ecosystem that help us define what is worth pursuing. Also, the idea of trying to help innovation in a hospital has evolved over the number of years. We used to try to support many different ideas, but the problem with that is every person's idea requires a lot of resource, and then ultimately it's very challenging to sustain that invention. And so what we changed the focus about 5 years ago with our innovation program, which is all about supporting the innovation ecosystem, but selecting the very small subset of very successfully, sort of predictably successful projects that we can help put real resources behind and get them to market. And so this means that we're not focused on accelerating everything, but we help everybody with their ideas. We have what we call a sprint process, where for every idea that comes in, we surround an innovator with experts in the area, with business strategy, tech, and then help them decide whether their idea is actually worth it for the market. This also means that a very small number of the ideas that we get into our accelerator ever get funded. So we may see thousands of ideas, both from within our organization and outside, but by the time they go through the steps of the application process, we have a very small number of companies that we've helped. And while that's challenging for the people that don't get in the accelerator, it helps them refine their idea and think about, and not wasting people's times with ideas that don't have market potential. We also work with companies and ideas around a range of the stages in the process. It could be from things that are in development, that require still research and development, projects that are in pilot, some that are actually extended. And so we have a range of companies in our portfolio at each one of these stages. The other aspect is we have different topic areas. So for the companies that we work with, there are particular areas of focus, whether that's developing technologies for screening, digital therapeutics, compliance. There are very different buckets of startups that we've helped to develop or work with that can help us sort of with important problems that we face within our own organization. So what I'm going to tell you a little bit about, and I move forward, and on the other side of it, it's not just the startups that we work with, but it's the larger companies. In each of these areas, we also work with top pharma companies, technology companies, all of which are supporting us towards our mission that I mentioned at the beginning, which is providing top pediatric care to the world. So I spoke a little bit about this in the previous talk in the voice session, but in a more broader way, a lot of our focus as an organization has been about reducing the burden of our providers. In order to provide best-in-class pediatric care, we have to figure out ways in which to minimize the overload that our physicians face with the use of technology. The electronic medical records have never been developed with the users in mind. And so we've been thinking about how to improve technology with a variety of different tools. The simplest one that we worked with and developed in collaboration with the company American Well is virtual visits. This idea that you can do a Skype-like call with your provider and have that be the interaction. That saves time for the provider, it improves patient experience, it ultimately is a better deployment of care. And ultimately what you can do is provide care to more people more broadly and reduce costs at the same time. So that's a very simple thing that one can do, and many healthcare systems around the country and the globe are starting to implement that. But what more can we start to do? Well, what if we start to think about the Uberification, or I guess, I don't know, it's the Yandexification of healthcare, and this idea is how do we take the excess supply of healthcare and make it more connected to people? So we launched a company called Nutremedy, which takes the excess capacity of dietitians, people that need to get a nutrition plan, and connects them via sort of an Uber-like matching system. We've also thought about how to reduce the workload for our providers. We often have a situation with our physicians are utilizing forms and tools and access databases to get insights about guidelines on what to do. We've now started to put all of that information in mobile apps and guide our providers to making better choices in their practice of care. I mentioned this in the previous talk is, well, still the idea of using mobile apps and technologies are still challenging. We've now shifted a lot of our work to working with Amazon and thinking about how to take all our knowledge and our care pathways and putting them directly into the Alexa platform. There's all sorts of companies that we've now started to work with that are all trying to optimize either the physician experience or the patient experience. This is a company called Ava, which replaces the nurse call button. So this idea that instead of pressing a button and a nurse coming, the patient can just speak into the device and then get feedback. So the patient asks for food, it sends the message directly to someone who can fulfill that. And it's improved patient experience and reduced wait times on the part of our patients. A big other focus of what we're doing is trying to think about taking our know-how of the hospital and commoditizing that, democratizing the information that exists. So one example is in learning disabilities. So the idea that many children have reading issues at a very early age. There are screening tools that can identify these problems way early. So we've developed a gaming platform that now allows you to identify attention deficit disorder years before someone would identify it in a school setting. And this is all through the digitization of existing know-how. Another area, and one that is big in the US, around concussions, especially with football, this idea that we can take the ability to understand whether a patient had a concussion through the use of virtual reality technology. So again, it's this idea that we can use screening using technology and actually take those tests and make it more available either to professional sports players, but also to students that are in sports at school and potentially have head injuries. The other component is gaming. We know that and we talked about this, that kids love their gaming platforms. I mean, adults love their gaming platforms as well. Why not make the gaming platforms themselves valuable to kids? And so Mightier is basically a gaming technology that modulates based on the stress levels of the patient. So a child is playing a car racing game, it detects stress, and it slows, for instance, the car until the kid can self-regulate. And what we've shown is that this actually can help with attention deficit disorder, and this biofeedback can be incredibly effective therapeutic rather than the traditional therapeutics. So those are just some examples. The other aspect of what we do is to try to take our know-how around acute conditions and make that more available. This is a platform we developed called KidsMD, which essentially allows a patient to go online and understand what to do when they have acute conditions. It's sort of based on a form-like tool, so we've thought to ourselves how to make these technologies more engaged, because the reality is we prefer patients to get informed before they come to our emergency department. There's opportunities for engaging patients before they ever arrive to the hospital. And so we've been working actually with a number of new technologies and chatbots. I'm sure many groups here are thinking about chatbot tools as a way to engage patients. Whether it's for scheduling appointments. We've been thinking about it for the purpose of symptom checkers. And so this is a company that we work with called Buoy that is a symptom checker tool that allows you to have a conversation with a virtual assistant and essentially gives you a decision about whether you should go to the emergency room or you should go to urgent care or have a telemedicine visit. And already these AI-powered technologies are having incredible impact on whether people decide to come to the hospital or not. And in high-cost settings like emergency departments, it's very important for us to tell patients that shouldn't go to the emergency department to go to other places like the urgent care or to stay at home. And then finally, I'll just mention that it's not just about the technologies and providing patients inside the home. We're very focused on new technologies around access and logistics. We know that there's this whole new on-demand world of ways in which we're receiving care that happens outside the hospital. we thought about this a few years ago when we went to Uber, which I know Uber's not here anymore. It's Yandex, but same idea. The idea that it's very challenging to get our patients to get the flu shot. But then we thought to ourselves, why not convince Uber to put a button on the Uber app and allow nurses to come to your home and deliver vaccine to your home. And we did this across the U.S. And we found that patients were more willing to get a flu shot because it was to their home rather than coming to see the doctor. And so you can imagine the opportunities in thinking about if you can bring Uber, Lyft, Yandex into healthcare, all of a sudden now you have an opportunity not only to bring care to the home, but get patients to their appointments, get them to home when they don't have a ride. It creates all sorts of new efficiencies. And so we've been developing platforms with Uber for years now, which have shown that we can actually improve the whole practice of medicine, reduce costs, improve patient satisfaction, all with introducing these new technologies. And so just to close up, in this data-driven sort of on-demand world, there's all sorts of new opportunities that are going to emerge and new partnerships that likely we would not have thought about in the past by bringing some of these technologies into play. So with that, I'll leave it and look forward to questions. Thank you. Okay.
John, thank you very much. That was a very energetic speech. John, thank you very much. It was a very energetic speech. You have created an efficient model, and we understand that the model is as efficient, the more efficient, the more ideas we have at the beginning of this idea. Where do you get these ideas which actually saturate the following mechanism that you implement? You have maybe some courses for unstandard thinking, or maybe you just help people to develop their ideas, to develop the intellect. Where do you find these ideas?
No, most of our ideas come from within the organization. It could be researchers, clinicians, and really anywhere, administrators that have a good idea but don't know how to implement the concept. We have programs. We actually have a surgical innovation fellowship where surgeons can spend a good chunk of their time learning about innovation and technology. And we're making innovation a core competency just like research. So very similar to how physicians get trained in doing research at the bench, they're getting trained in technology and innovation development.
So do I understand you correctly that there are ideas, there are lots of ideas, but you need to be capable of taking this idea and identifying them?
There are many ideas that come through the organization. We try to help everybody understand that it's welcome, that everybody should come and challenge their existing their practice, right? So everything is open for change. But what we don't want to do is build a whole ecosystem of pilots in the hospital that ultimately can't get sustained. So we try to educate people that you have to come up with a good business model, you have to come up with product market fit, and there are many startups and companies building the same thing. So we can't assume that everything within our hospital, the ideas are original enough and worth building. Yeah.
Thank you very much. Well, our virtual plane, which is going from Seoul to Boston, is landing in Moscow now, and we give the floor to our pilot, Vladimir Makarov, who will speak about what's happening in our country. Maybe we can also share something with the world. Well, now, good evening, I think, and I see some familiar faces, and I was listening to the speakers, and regardless of the fact that the case is well known, and once when we saw the opening of innovative cluster, we participated in all the celebrations of this opening some years ago, maybe like 4 or 5 years ago. Even then we had some feelings like we envy in a good sense, but I would like to share such speculations how we live with that and how we are going to deal with this later. Well, the idea is that everything is quite simple, relatively simple. most of what belongs to technologies today, it's like an anecdote. When a grandmother comes to a polyclinics, comes to a registration office and wants to make an appointment with the doctor, and they ask, what kind of doctor you would like to see? They say, well, I need a doctor for ear and eye. I say, well, and where do you have pain? We do not have a doctor like this. You know, what I see does not coincide with what I hear, so I have to deal with this somehow. Well, and it does not characterize the degree of development of technologies. It characterizes the degree of readiness of the product. So we should understand that most of the things we discussed today are related to stories about technologies. It's not about the out-of-the-box product which can be bought, which you can unpack it and it will work. Well, why I started speaking about this? Because number one, all these products are more or less, all these technologies are more or less a kind of atomic structure, and their usefulness and their implementability in the scale of the city life requires kind of cooperation, first of all, between the developers of these things. And I'm not even speaking about cooperation in a wider sense, and it's not actually possible without medical people. And as to medical people, it's a separate story, and I think we'll get back to that. And this cooperation requires some efforts and clear-cut financial expenses, kind of foundation, as colleagues said. And medicine in Russia is a very specific industry where we have 85% of potential consumer is in the sphere, in the zone like responsibility of the state. And to play with the state on a long-term basis, I'm from business, and some years ago, more than 10 years ago, and that is a very vulnerable position, especially if we're speaking about long-term strategy. I just say as it is, and you can interpret yourself. And just imagine a situation that without getting support somewhere from the top or somewhere a little bit below, from Mr. Grev, for instance, head of the largest bank of Russia, to get into long-term strategy of investment in order to create the necessary product out of a combination of technologies, and this is related to medical people. So this is a story which is not realistic here. And from my point of view, this is one of the quite considerable problems because in Russia and in Moscow, it's quite hard to say that we do not have good IT people, that we cannot do something. If you keep track of us, we keep on winning different competitions on informatics, or we are among the first three positions. And this is not the story about resources, but you see quite well how these technologies occur in similar areas, and they develop very fast. And there are things that, like 5 years ago, we couldn't even suspect that it can be like that. For instance, that very car sharing and the whole system of infrastructure behind the automobiles, it's not a small story. However, finally, we get to understand that if we, as representatives of the state who represent the largest network of clinics in the Russian Federation, if we do not deal with that personally, I'm not speaking about invention, but I'm speaking about merging and investment part, then it will not work. Then we get to the problems that can happen here. So, see, here we have specifically trained person, Yulia Urozhaeva, who came to us like 7 or 8 months ago with only one purpose. She is a generator of clinical decision-making support system in different areas where will be of more priority, where we'll have better results. And we keep on meeting with different companies on a regular basis, and one of the tasks that we're trying to solve is to go to diagnosis.
of different diseases based on the complaints, just to give some kind of a hints of the doctor, and just to give information in a very efficient way without going through different codes of various diseases, and just to give advice what kind of diagnosis a patient should be sent for. So it hasn't been finalized yet. Of course, it takes more cooperation with medical specialists. We need to process a lot of big data, mass data, etc. And it, of course, requires finding how does our government work. We have the so-called federal law number 44, and it is now being really criticized by a lot of our colleagues, but I don't mean to do that. Maybe, yes, this law is not that good. Well, it's not bad either. So, for example, if I'm a public official, I cannot, order some kind of work in two places at the same time, because in this case we are risking to have the so-called double funding. And secondly, our governments likes when they just conduct some, scientific and research service, we usually prefer to work with the so-called exclusive rights. And if you perform your work, accomplish following our order, then you are supposed to give us the rights on this work. But when we talk about some connected technologies, if a product is created, if it doesn't have some parallel life and permanent developments, such a product might just die out. And it's quite inert. It's also, this kind of approach is supported, unfortunately, by the government. A lot is being said about this, and we're discussing that. But as for the philosophy, the philosophy itself, there is none right now, and we should say that our technologies, based on the following principle, leave us alone. Medical specialists say, leave us alone, and we want to perform our duties on our own. We also have a very interesting example with this special app for children as to how they can cope with the stress, etc. So you can understand that I'm just an ordinary public official, and I don't want just an ordinary specialist, and I'm quite a typical representative of these circles. For example, I announced a special competition bidding for a particular app or development at the price of 3 million ruble, which is quite normal average real figure for Moscow. So we would say that if we talk about the prime cost, this is like the average, it's the annual income of an average person, citizens. And of course, immediately I will be criticized for that, because people, they always complain here that they don't have enough money for medical assistance, for pills, for products, for everything. So, and if it anyway doesn't lead to any results, and it's I will be not just criticized, but I can even be taken to prison because I just, for example, took this, I don't know, 3 or 5 million ruble and just wasted it. And that is why it's very difficult to work on this way. So we should say that traditional models no longer work. Why? Because it's not possible to organize this kind of a partnership between government and those funded units. But we also have also the so-called state and private partnership. Well, I have heard about it for 10 years. I'm not mean to say anything about, for example, road Moscow, this highway Moscow-St. Petersburg. I'm talking about some other examples and cases. Well, not long ago, we got a completely new approach. Like an effort, as we call it, to play with grants. It's a nice thing because they are some kind of a mechanism, and they kind of allow to use certain funds, almost, the allocate fund for a certain purpose. But the mechanism that provided by the local legislation, they are quite tricky with the decision making, because we have this huge funnel, and where we have a lot of questions. Are you sure that they are not your relatives or people you know? Probably this is like some kind of bureaucracy. During the last session, I said that we managed to overcome certain barriers. We have a lot of data. We have quite a good coverage and also a good level of implementation of all those information technologies almost everywhere. Yes, and we only need to focus more on hospitals right now, and that's it. And of course, inevitably, we have to think about real breakthrough and results that we want to achieve, because we want to use our technological environment. And during one of the presentations, a presentation by my boss, by the way, by Anastasia Rakova, it was mentioned. Yes, she said that we really want to create, to found a real technical city, the so-called Technograd. Life is developing very quickly, and 10 years ago you could hardly imagine that we will be sitting here using our gadget, taking pictures, making calls, listening to our session, just using this little device. Well, I think that yes, the first iPhone appeared in 2007 or in 2006. I don't remember actually. So you could hardly imagine this picture back then, and they understand that we need dynamics in this domain. We have very good practice, and it's true that not long ago we got a very good team of people that also needs to be funded. And again, I will have to explain on a regular basis what they are doing, why they travel abroad, go to different conferences, to all those supervising bodies. And again, we also need to understand how it is actually related to the information technologies department and how it is all organized. That's a real puzzle. Well, of course, we want to look at new practices, so we want to analyze them. And I have just said a lot, and based on that, I think that you understand. We don't know yet how to do that very well. We're just searching for the right ways to do that. And so far, we cannot say that we are being successful. We cannot say that, okay, you need to take this or that, go to that place, push this button, we get resources, you get new technologies, and you will be enjoying it, etc. Well, there is no transparency so far, no clear mechanism, but I think that we are very close to it, and maybe this year we already see it appear. At least we have already made certain plans. We also need to remember that we have so many governmental structures. For example, this department for state surveillance, etc., and all those new solutions and new technologies needed to be approved by all those bodies. All those issues related to licenses and permissions. Well, I hope that we will manage to find the right mechanism. We hope that we also be able to get some best practices already available in the markets. I, for example, like the practice of the Massachusetts hospital. They have already applied a particular strategy, and that's really great. Our president says that he is expecting some kind of a breakthrough for us, which means that we will have to tackle this problem anyway. And in this context, we should say that we wanted and we be happy to get any kind of assistance from you. Let's create a mechanism that could give us an opportunity to interact and to participate in joint investment in different technologies, not only in the previous mode, but in some new context. And let's not just think who will be the first to get all those approvals and I don't know, licenses with all those things and the bureaucratic problems. So, Mikhail, that's basically it. So that was I wanted to say on my side. Vladimir, thank you very much. I have the following question for you. So now it turns out that well, I do understand that you just decided to share your take on that, your ideas from your position. Yes, you shared probably your main ideas regarding this issue and pain that you have. But I have a question. Honestly speaking, our medicine today, medical sector in Russia, in a quite complicated situation. Let's be honest. Right now, our healthcare system is such where neither party is satisfied. Neither patients nor stakeholders or medical specialists. And we have just looked at the experience of South Korea. They're very much oriented towards information technologies. Do you think that actually information technologies could become this kind of magic wand or magic stick where it could be used to sort out all those kind of problems? I listened to our European colleagues and actually they say that a lot has already been done in Moscow. But do you think we have really achieved certain results? Got certain good results? Well, first of all, I should say, yes, probably we are sitting close to each other, but I think that we just cannot hear each other. Well, point number one, I haven't seen any country where citizens would be satisfied with their healthcare system. I've never seen a country where everybody would be satisfied with healthcare system, like we don't need any reforms at all. I've never seen some cases, maybe for example in Africa, they don't have any healthcare system, probably they are quite happy there. But it's just an eternal story. We have to develop all the time, and it's all about development. I'm not quite sure that you can actually measure the efficiency of healthcare system based on a satisfaction level in this case, because at the end of the day, we should say that healthcare system and can also consume as many resources as possible, and still there always be those left without any resources at all. And even at the United States, it's also the case. You can spend a lot of money on that, but still there will be people who will not be covered by that funding and all those finance. I think that here we need to consider other indicators. As for my general assessment of the industry, me represented in my side, I should say that I like something that is happening right now in Moscow and also in healthcare system. Not everywhere, but still I can see a lot of positive trends. We still have a lot of failures. For example, medical specialists themselves, they are not really satisfied. But it's not because someone from above is trying to impose stupidities upon them. No, just because sometimes we have different understanding of the same things, and we cannot always manage this big mechanism of this body. It is not that easy. It's true that something happened in the healthcare system over the past 10 years. From my point of view, that is fantastic. What about opportunities that could be provided by information technology? So there are several things that I am persuaded sure about. Well, digitalization, artificial intelligence, big data, etc. These are just instruments, no more than that, that can speed up the certain processes, assist us, but they cannot solve our problems. I think that I believe that aliens can visit our planet rather than we'll be able to solve our problems. And the second point, I should say, is that all those problems that we have in this sector without the use of information technologies, that is not feasible, I assure you. Moreover, if you try to turn a blind eye to that, or like we say, a deaf ear, and just to say that it is visible. Well, no, it's not possible. I'm absolutely sure about that. Those opportunities that we have today, those opportunities that were given to Moscow, they really can allow us to move forward. It's not just about improvements, but it's also about real changes in our technological environments, our technical environments, with a completely new approaches and new ideas, with a new environment for doctors as well. I don't think that that there is a real problem that could prevent us from achieving our goals. We couldn't say that we're not giving any money. No, we do allocate funds for all those purposes. I have never seen that. I wouldn't say that we have some, I don't know, normative barriers or legislative barriers. No, that is more of a myth rather than a reality. So we have very interesting documents and different statutes and many documents that we use in our work, used by us in our work as guidelines. And also back in the Soviet times, they also have very good system. And of course, it's changed a lot, and now we are living in a different era, and it will be changing even further. But we still sometimes have to understand that we have to work with out-of-date forms or norms that are no longer relevant. Unfortunately, it is the case. But we know that still there are a lot of people who are really vulnerable, and certain sectors are really vulnerable, including, for example, medical specialists themselves. And it's in our falls within our scope of competence to improve the situation. So I more or less understand you. I understand that we state officially that information technologies have already become an integral part of medical sphere. But what about you, Nikolai? What do you think? Do you think that doctors need all those innovations? Yes, it's true. There is an issue of communication, and there is also an issue of software that could help us use communication to use it to our common benefits. So communication is needed for cooperation, but communication is not the only factor that's a sufficient one for cooperation. And in this sense, we have to understand that doctors and medical specialists is a quite dispersed, diverse field of expertise. I actually also have a medical background, by the way. There are also doctors, for example, absolutely conservative. They don't speak English. They don't like to read new books and new articles or visit conferences, etc. I also know some progressive doctors. They use information technologies in their systematic regular life.
And it is really related to young doctors. Definitely, this is the future. And today, even it's strange to think that some problems like that are here. But I would like to speak about a wider contour, because we consider cooperation even outside the frames of what we discussed today. And my first slide will be with a quotation of a colleague John from university and Professor Martin Novak. His group of evolutionary dynamics of Harvard University. People are inclined to think that evolution is a severe fight for survival, but actually the force of revolution has always been cooperation. And if we consider evolutionary process, a life system uniting with each other, attributed capabilities to create new properties contributing to survival of the system, so-called emergent properties, and the process of the supersystem establishment to sustain their livability, which truly need communication. So these are the factors which brought us here. We are here and speak about these things. And in this respect, when we consider problems of healthcare or health or medicine, we should understand that preservation of development of cooperation at all the level of the systems is an indispensable condition and actually main focus of this evolutionary process. What has always evolutionized are two things. Number one is the scheme of cooperation, soft cooperation, and the second thing is communication, which facilitated that. Well, looking at a main target around which we are located, this is health, this is wealth, and we would like to get pleasure in life and realize our creative potential. And it's important for us to understand that in this system we have some players who have to cooperate with each other for the system to operate for mutual result achievement. Like in my body, cells cooperate so that I could pronounce these words. In the same way, all the players of the system should cooperate. And who is cooperating actually? Number one is a human being, and even a human being, because a patient is actually kind of attributing to some class. And well, human beings are all together. With whom we cooperate first of all? First of all, with himself. A human being has to agree with himself to get some results. Then members of family, friends, and other patients similar to him. These are also doctors, social workers, psychologists, representatives of administration, of different institutions, universities, engineers, researchers, representatives of government. If we get to upper level, then we'll see cooperation of the bigger system. So these are more than like preventive institutions, educational institutions, healthcare institutions of separate regions, of separate countries, and also international cooperation. We also see intra-industrial cooperation, in technological convergence, and also biopsychosocial approach is also required in healthcare as a model. And all these elements of the system, like in a live human body and brain, they cooperate totally different neurons with each other, and they should constantly exchange information in like on air, live exchange of information, and give an opportunity to understand the situation, taking every part of the system, and continuous exchange of information is of utmost importance to get effects. So what happens in our university? Number one, what is our university? This is the largest medical university in Russia. The main national center of staff training and postgraduate education with the largest spectrum of educational programs in the area of medicine, science of life, a national research center in the area of medicine, and the only university of 500 project. And whatever was mentioned today on behalf of our colleagues, well, it can be implemented. It seems to be that these are quite simple things like cluster policy. I'll speak about it later, but I would like to speak about the most important things. I have singled out main cases, like first of all, social neuroscience and its application to facilitate cooperation. This is continuous personified health management, biomedical park, digital transformation of healthcare, and organization cooperation. These are the main things which are most important for us. And in connection to the point that colleagues have already said about digital transformation, about organizational points, about biomedicine overall, about convergence, I would like to speak about first 2 points in more detail, because here we have some considerable innovations which are different from others. And the first thing and the most important one is the issue of cooperation itself, because the idea is that if there are problems with cooperations by the patients in their current routine life, it can seem like a stimulus for development, like a cat in a Russian cartoon is saying, let's be friendly, and recent researchers show that loneliness of a person when he's falling out of the context of trust, of cooperation, is the main factor of mortality risk from a large spectrum of diseases. For instance, so women who are socially isolated before they have the diagnosis of breast cancer, they die 200% more often in comparison to the women who are socially integrated. For instance, recent research of Harvard University in 2013 published by Journal of Clinical Oncology, 1,260,000 people participated in this research. They tracked the connection between the family situation and the mortality rate from cancer diseases. This is a wonderful work. I recommend you to read this. 20% is difference, and the researchers said that for prostate cancer, for cancer of gutter, and the influence of family position for survival rate increased the influence of chemotherapy. And for instance, the influence of family conditions from cardiovascular diseases, from heart attack, it's like 50%, and from cardiovascular diseases, 43%. These are totally gigantic figures, gigantic influence, and we underestimate these factors when we consider the healthcare system. When we speak about healthcare system, we mostly speak about some medical things, and I was happy for these 2 days because Sergei Sobyanin said that social stress is the most important factor. And it was also mentioned today about philosophy, motivation, involvement of people, about healthy way of life, we have this healthy way of life, which is based on cooperation, which we are talking about today. And when people start cooperating, they have an additional opportunity to deal with healthy nutrition, fitness, and so on and so forth. So in our university, understanding the importance of cooperation, especially for teamwork, for medical teamworks, and all over the world there is such a notion as tumor boards, when we use a team of different specialists to deal with the disease. So understanding this, we asked ourselves, what prevents us from arranging this cooperation and communication? And we have the systematic psychophysiology. Now we work with the colleagues from abroad, and the day after tomorrow we will have Professor Nicholas Rustans. I recommend you to listen to him because he has created a wonderful work. And Chicago University, and Junguchova professor, who unfortunately expired, he was involved into social neuroscience, and we're somewhere in this process, and we have developed a dialogue which helps people to find understanding with each other, and it is based on a very important practice of feelings and emotions exchange. That is, empathy is actually a basis for cooperation. First, we understand how to feel together, what's happening in reality, and then we can efficiently cooperate. And in Stanford University, there is a wonderful training which is called Compassion Commitment Training. James Doherty, who is leading this position, he's a famous neurosurgeon, and they're dealing with similar things. And we started arranging these groups. We started training our patients to cooperate with each other, to share feelings and emotions, and we were surprised to see that within 1 month, only 1 month, the level of quality life measured by methodology of World Healthcare Organization, WHO 100, is growing by 25% within 1 month only. Well, dear colleagues, maybe you know some medical technologies which helps to improve quality of life by 25%. Well, probably not. And actually, we have growing cooperation between patients and doctors, what is called compliance, involvement into some specific practices, and creation of stereotypes of healthy way of life. And Basically, we have found a key to create such efficient communities of mutual support, solving problems of loneliness and trust. And naturally, people have horizontal communication. People get cooperation in totally different spheres, not only in the sphere of health. We have translated this process to teams because it's very logical. What will happen if this kind of cooperation will be arranged in teams? We started working with companies, with large Russian companies, and we started explaining elementary things. You come to an audience, to a room, and ask, what is the most terrible for premature death? Well, physical activity, nutrition, but nobody knows that one of the most terrible things are social isolation, loneliness, and lack of trust. But when we explain this, people start understanding how communication is related to health condition. Well, there is improvement of the personal health, but also health of a team. The team becomes more efficient, and here there is a surprising process taking place. Let us say a team where suddenly this barrier of communication is removed. We feel like it has always been at a brake and acceleration pedal at the same time and never moved. And when you remove the brake of communication, the team makes like take off. And one of the teams is Almatyevsk in Tatarstan. 4,500 people, all refinery industrymen. We taught them how to get more emotional and more empathic. They grew from 6 to 14 billion profit. It's an incredible boost effect of the production rate and efficiency rate. So everybody wins in the system. Speaking about foreign examples, there is a wonderful example from a town in Somerset, England. There they integrated and created such a project, Compassionate From. And people, well, there was a network of volunteers who are called health connectors, and general practitioners prescribe communication recovery for the patients. So they decreased the number of emergency hospitalization by 2 times. So they scale this project now. And in our university, I would like to tell you, there are quite a few people who can make forecasts, and mainly we work with large companies like Kaspersky Laboratory, Vita, Profi, RU. Also, there is Ministry of Industry, and we have done this for them. We have arranged days of open dialogue. We have implemented it online, made 2 spin-offs, School of Open Dialogue and System of Health Management to recover health stereotypes. And this also expanded the limits of medical approaches. And today we are speaking about biopsycho social integration in medicine. And finally, we reached to the point that we train doctors and everyone, actually very wide. This is the main thing, and this gives an opportunity to create continuous management of health, because a patient-centered in healthcare, there are some groups, teams that should work. All that is clear. However, here the function of a doctor becomes more like that of a doctor or manager, and we train, we provide service, and that has already been mentioned. And that exists, that is reconsidered our spin-off projects. There is a Clinics of Health Management, Institution of Personalized Management, Clinical Center for 3,500 births. So all that is united around the patient, and together with the rector, we have shown this model, and now we're to the president, and now we're implemented that. And I don't want to speak about details of cooperation of some technological kind, because let us say, like in the university, there is Scientific Technological Park of Medicine, also similar cluster, global international consortium, lots of countries participating, a couple of Nobel Prize winners, and university cooperation. There are also some achievements already, even though it is quite a fresh project. And also digital transformation, and this is online education and also organizational cooperation. lots of things are done here, and these are quite general things. And the main thing I would like to tell that soft is the most important for cooperation. So we should have social soft of how to cooperate with each other. When we learn how to do that, then it's much easier to implement totally different innovations, because they will be very popular. Thank you for your attention. Thank you very much. I think it's a very continuous, competitive for Seoul and for Boston. I think it's quite a revolutionary idea related to communication. Dear colleagues, well, we have some time. Let's arrange it kind of a discussion. Well, Yulia, as you have already been announced, Yulia Urozhaeva, well, we'd like to have a mic. Well, dear colleagues, good afternoon. Well, I would like to make some notes. A question to Dmitry. Could you please tell, communication in social networks is considered to be a communication? It's like when you have Facebook, you think that you have friends. But a question to John.
We were wondering, how do you exactly motivate your personnel, I mean doctors, researchers, probably medical personnel, to give you ideas, to bring innovations, to participate in this fantastic process you described? Thank you very much.
Well, communication in social network has two specific limits. The first one is that we give not complete information about ourselves to a social network. And I do not translate myself there, but it's kind of I made zeros from double code only once, and the sense is lost. So, and this information traumatizes, and there are lots of researches that this information can actually be traumatizing for a healthy person, but a person who has genetic inclination for such diseases, they can reach very hard emotional conditions. So you need to know how to use social networks, and there should be information hygiene, so to speak, for children, for us, for adults. So it's very important. On the other hand, social networks are a perfect tool for communication if you know how to use them, if you know them purposefully. That is why I'm firmly convinced. I work a lot, almost all my activities online. We travel a lot. That is up to the question about different systems of healthcare. Well, I love Moscow. What is done here is just wonderful. It's cosmos. So when you travel around the world, you understand how great it is here. So online is really cool if you know how to use it correctly. And that is why I would like to make lessons of this information literacy so that you understand how to do that. We'll discuss it here. Thank you. With pleasure.
It's a great question. Just to mention about your social networks, a lot of our work, actually, which I didn't talk about today, is in this concept of digital phenotyping. We started a whole field where we collect a lot of information that people generate in their activities online. And yes, it's not a complete picture, but it's also many things that patients never report to their providers. Maybe it could be mental health, it could be drug abuse, it could be many things that are important for health outcomes, but will never get into clinical records. So we work with companies like Facebook and Twitter to utilize that data and help us understand things that range from infectious disease to chronic disease to addiction. On your question about motivating providers, it's very hard, of course, but we do things like hackathons and showcases and really get engagement to understand sort of the possibilities. Also, what we do is we work with a lot of outside startups. In the Boston area, it's incredibly a vibrant startup digital health ecosystem. So when they come to work with us, we identify clinicians that are in our institution that have expertise in that area, and we often match them with that startup. And so that gets them quickly working as an advisor to a company and really allows them to understand what's beyond sort of their day-to-day activities. I can't hear you.
What about your in-house personnel, your doctors, your researchers? Do they get some financial motivation for ideas? Or?
So we have a few clinical advisors on our team, and a percentage of their time is devoted to working on our team. So helping us identify good areas, but also helping motivate other clinicians to really think more creatively about what they're doing. And so there's definitely incentives. Also, the clinicians can get equity, so stocks in the startups as well. So they get additional potential opportunities for revenue. So they don't just make their own salary, but they might make additional money from the companies that they work with as well.
Thank you very much.
Thank you.
Well, I would like to give the mic to the first line, but the first question is how to create an innovative product and where to find ideas for that and funds for that. This is great. And the second issue, how do you go to the market? Just a moment, I would like to ask Alexei to give him the microphone, because this is my personal curation. And in the company, I really like the products you have created, and that is truly innovative. But the colleagues, well, you'll be the second one. I'm sorry, but the colleagues have some complications with the integration into the market, and I would like to ask them to send this case and make their offers regarding what they would like Vladimir is here, from what they would like to get from environment and from city governors to facilitate this way into the world. Alexei.
Mikhail, thank you very much. Well, first of all, it's not that bad. Despite the difficulties that we have in the Russian system, the company can really provide diagnosis for 50,000 patients per month, which is comparable with Bundani. But I have a hypothesis related to our today's subject of this panel discussion. Could you please just describe very briefly the product, because not everybody knows it. So the company on one side creates a digital pathology, this kind of technology, so it converts this diagnosis process into real figures. So in this case, we can use automation tools to attract doctors from around the world. On the other hand, the company has already become a big player in Russia, over 50,000 patients per month. Now they have already spread to some other laboratories. We are going to have and get new laboratories working based on this software. It's quite a unique thing, and we don't have that many digital technologies right now in Russia. There was only one, and no more than 10 in the whole world. So hypothesis is, well, apart from everything that has been said today about accelerators, technological clusters at big hospitals, I think that collaboration of a technological business and a finance system between these two is also important than like Mind Combinator with technological industry in the United States. What do I mean to say? I'm talking about other insurance company or a finance system in Russia. So if a technological business had any preferences or at least equal access to resources, for example, in Russia we have this kind of refinance systems, but state medical establishments, they have more preferences than non-technological or private, for example, medical establishments. I think that's one of the customers who would like the quality to be improved. They would like to have faster speeds and better quality at a lower price. Technology is just instruments. So if it actually helped and stimulated the technological business, then it could be no worse than the development of a technological startup in Y Combinator. Thank you very much. Maxim, you wanted to say something? Maxim. Dmitry. Oh, sorry, Dmitry. Yeah. Yes, I want to comment as a representative. It's a very nice story. You see? Almost everybody complains that within the tariff system of this refinance system in Russia, we don't have any direct tariff that could be used in order to substantiate the use of different smart devices. For example, distant teleconsultations or computer vision or use of similar technologies for laboratory diagnosis. It is really interesting. Why? Because on the other hand, we don't have an opposite situation where we had a complete ban on the use of the resources that can be found at medical establishment in Moscow to optimize their capacity and to attract some other organizations for services. You understand that in Moscow, polyclinic assistance is also based on a particular approach, per capita, as we call it. So you can use artificial intelligence or radiologist, but how we can boost our efficiency? At the same time, I said that I will touch upon medical cluster itself and medical specialists. We have another example where we see that they also pour funds for some reason into all that, they're providing a certain thing to do that. It's a very good reason to just try to understand how it works. At the same time, in the medical insurance, we don't have any corresponding tariffs. We don't have any clear borders. But as for the rest, I cannot see any barriers or restraining mechanisms. Vladimir, I wanted to make a short remark. Right now, yes, Dmitry, I have a question for you. You said that the biggest problem is that people cannot communicate or talk with each other using their mouth. And I work in a special structure that's working in the sphere of X-ray diagnosis. And I represent here this company. And we always have a problem misunderstanding. What do you think? Could we use your methods to just teach people to communicate between each other? Probably the Ministry for Economic Development and the Ministry of Health could also communicate in a more efficient way. Thank you very much for this question. Yes. Of course, we need to take all those people and those customers and teach them to do that. We, by the way, received an interesting request. The Ministry for Economic Development, they moved to Mincifra, that is an open space area, and no one there was ready for open space. That was absolutely new for us because they had to communicate with each other. And they said, please tell us how to work with each other in such an atmosphere. We started to do that, and I should say that it was quite easy, which is not very easy at the beginning, but later on we managed to arrange that. And by the way, I know Mr. Morozov, he's a good friend of mine, and actually we can try to arrange this kind of sessions just to understand what our main challenges are. Apparently it can be done, and even in more complicated situations and environments. I just don't want to waste our time right now. I just want to say that this is feasible and we already had such an experience. I should say that could open some new horizon for us and provide us with new opportunities. And colleagues, we have time for 3 more questions. Good afternoon. My name is Roman. I am a doctor from Moscow. I would like to react to Vladimir's speech. Next year, like you said, we will have to overcome all the possible barriers that you mentioned. Otherwise, our life of doctors would be really terrible. And for patients, I have a question for our colleagues from America and Korea. So ideas rule the world. John, you showed in your presentation how you select your ideas so that later on turn into technologies. So I would like to ask you, who specifically decides and whose money are taken to invest into startups? And if it turns out to be a failure, who takes the risks? And also the same question goes for a colleague from Korea.
Yeah, it's a very good question. I presented, we have many advisors from different companies, startups, from venture, but at the end of the day, the decisions are made by the hospital because it's the hospital's funds. It's actually, most of the money that is used to fund the startups comes from philanthropy, so donors that are providing us support. And the way they see it is that by donating to the hospital to help with these ideas, maybe $10 into one startup turns into, $100 later because it's a return on investment. So we quantify ideas both on the mission. So is this idea going to help the mission of the hospital, which is providing top care for kids? But also, is there potentially a return on investment? If we put this money in, are we likely to see money back and maybe even some form of profit? And so we utilize those two ideas. And so far, we've had multiple exits, so funds that have come back to the hospital to support us. And so as long as we're very dedicated to being very specific about the ideas that we fund, we have found that, in fact, these things can help fund future ideas as well. So that's the way that we've approached it so far. Yeah.
I think the question about the decision is not asking about the project going on, might be asking about the project going on or off, isn't it? I think in that case, we have to think a little bit simplify. The startup or engineer, what they wanted is develop a new technology and then making a business. And on the view of the medical doctors, what they wanted is they want to help the patients. That's the first things the doctors wanted, whatever or which technique they use it. And the hospital and institutes are helping them to making one team. And for the project going on and off is depend on to startup and also for the doctors, because ideas is coming from the doctors and some kind of technology or business models are coming from the company. But one thing the hospital could do is, as previously the colleagues mentioned, that the formal model for the profit sharing, we have a rule. So like if the startups are joining with our medical doctors, and some portion they will be donated to the hospital, and some of the little bit portion could be go to the doctors, and also the other portion will be go to the business company. Those kind of rules we already have. So business company have a approval for those kind of rules, they could be joining it. But the important thing is, whatever business or whatever technologists, whatever doctors they have, the business model should be appropriate for the market, because in the future the project result is very good and business could be, we will try to going on. But if there is no market and no consumer and no one to pay it for those kinds of a service, it could be failure. But anyway, for the failure for the business depends on the company, but the result from the outcome is also to depend on the medical doctors, institute, also the company. So this kind of a thing is laws and responsibility is sharing with between the company, doctors, and institutes.
Well, I would like to add a little bit, super short. Well, one of my activities is a very interesting one. I am a member of expert collegial body in Skolkovo Foundation, and we have made expertise of lots of projects in Bortnik Foundation as well. And now I just would like to support the colleague, because there is one main problem of most of Russian projects. It looks like people are located in some space space vacuum. They do not feel the market. They do not understand who a consumer is, what money is, and where is a specific result of the activity. Sometimes you read the project and you feel like a person is living in his own microcosmos, microspace, and he never came out and never communicated with another human being and never double-checked this project at the field. And sometimes there are totally wild things. So this is number one. And number two, there is also a notion of ecosystem. We should understand that, for instance, in Korea, I know Singapore better, actually, or maybe Europe, but the thing is that I spent lots of time in Asia. I lived there 7 years, and I can tell you that it depends a lot on the presence of the chains of production chains, added value creation, and in our country, unfortunately, cooperation and communication is a hard thing, but it's a subject for a separate session. Dear colleagues, unfortunately, organizer asked us to finish. Thank you very much for this interesting discussion. All the speakers are here. You can communicate with the speakers, and thanks a lot for everything. See you later.